Hi, I'm Dr. Charles Procter with Beltline Health. I've been a bariatric surgeon really since I finished training back in 2007. I'm originally from Georgia. My father's a surgeon who was also in the Air Force, so we hit about 9 different states as I was growing up and eventually made full circle back to Georgia. I did college twice. I went to Miami of Ohio, where I graduated back in 1994. I worked for about a year and decided I wanted to go back to school in order to become a doctor. So my family being in Georgia at the time, I went to the University of Georgia, where I graduated 3 years later with a degree in cellular biology. We then went down to the Medical College of Georgia in Augusta, where I was for 4 years and got my MD degree. I began my surgical training at the University of Kentucky, where I was for the first 3 years. My mother had some health issues, and so after my 3rd year, I decided to transfer back down south to get a little closer to home. And I finished up my training in Greenville, South Carolina. From there, I joined my father's practice. Actually, they were in Gainesville, Georgia, which is sort of on the northeast portion of Georgia near Lake Lanier. And that's where I had my formative training in bariatric surgery. Back then, we were mainly doing gastric bypass, sleeve gastrectomy, and some lap bands. After about 4 years, I moved down to Atlanta, where I joined a small group and continued my bariatric practice. I was with that group for about 4 years before, unfortunately, they dissolved. And I decided at that point that while I really enjoyed bariatric surgery, I loved everything about it, I never felt like we were, I shouldn't say not doing it right, I felt like it could always be done better. And I wanted to design my own program. I wanted to design the patient experience and everything about it. So I decided to start my own practice. And in 2016, I started out of a borrowed office space where I was for a year. I expanded down to Noonan, Georgia, which is about 45 minutes south of here, where I borrowed some more office space from some colleagues of mine and began seeing patients down there as well. After about a year, we were able to expand enough where we brought on board our own dietitian, eventually our own nurse practitioner. Now it's 2021 and we have offices in 3 cities. We've got multiple mid-levels that are helping with our patients, as well as dietitians. We have 3 surgeons in the practice, and we have a separate medical weight loss practice to go along to really enhance the patient experience. One of the really important things I felt like needed to be done with the bariatric practice is to really bolster the aftercare aspect of this. Most of the other practices I've been involved with were more focused on how many patients can we get to the operating room, which is understandable. That's the economic engine of the practice, but it doesn't do a lot for the patients. Just because you operate on a patient doesn't mean that that's going to fix every problem they have from then on. I felt that lifelong follow-up was going to be the key to long-term success for the patients, which is why we established Beltline Weight Loss, who manages all the aftercare for our patients and allows us to follow them lifelong, as long as they feel like staying with us. Our surgical philosophy is very simple. Patients do better when they understand their bodies and they understand the surgery. So anytime I have a new consultation with a patient, a lot of that consultation is spent with me discussing with them why it is they have such a hard time losing weight before surgery. It's really a physiologic conservation of fat that they have. I want them to understand that all the failures they've had in the past with regards to losing weight, keeping that weight off, are not their fault. It's just the way your body works. Once they have that understanding, we can move on to talk about bariatric surgery and how bariatric surgery will actually change that physiology. So it starts on the front end with education. Now, when I see a patient who's interested in bariatric surgery, we don't jump in and say, hey, listen, we've got OR time next week, let's go ahead and do this. That's the very beginning of the educational process. This is a process that takes weeks and weeks and weeks. Nobody learns this overnight. I certainly didn't. Patients need to understand what their diet progression needs to be going into surgery and after surgery. What kind of vitamin supplementation do they need? There are issues that they're dealing with, such as being emotional eaters and stress eaters. So they meet with a bariatric psychologist that's going to help them with that, not only before surgery, but carry on with them after surgery. I think it's important for them to meet with other patients who have walked this walk before them and get advice and help from them. Certainly we want to make sure from a medical standpoint that they're safe to undergo surgery with us before we ever get there. So there's a number of things that we do to try to set them up for success. We don't count a success when a patient has lost, say, 100 pounds a year after surgery. I know they're going to do that. That's easy. Success comes with where are they 2 years, 5 years, 10 years down the road. That's when we declare success, when they've been able to lose that weight, keep it off, and remain healthy for years to come. I honestly didn't know what bariatric surgery was when I got out of training. I course, knew what it was. I'd heard of it, I've seen it. I knew my father had been doing it for 30-something years, but I'd never seen a bariatric case, so I didn't know what this was all about. You know, I came out of training wanting to do trauma, wanting to be a general surgeon, kind of to operate head to toe, if you will. And while that was fun and while it was rewarding, nothing was as rewarding as taking a patient in who has been frustrated their entire life or their entire adulthood and trying to lose weight, and they're seeing these different disease processes come on, like diabetes and high blood pressure and their inability to have children and so forth. Do an operation on these patients and watch the change not only in their physiology, watch the change in their body, but watch the change in their attitude and their outlook on life. When they're losing 200, 300 pounds, all their medical problems go away. They're walking in and they're happy and they're smiling and they feel good about themselves for the first time. That's intoxicating. And it's one of those things where I just didn't get that from the other general surgery stuff that I did. So very quickly, as quickly as I could, I shifted my entire practice to do nothing but this. Probably selfish on my point because, you know, that's all I wanted to do. That's all I wanted to see. So it's not hard to see where the passion comes from. I think anybody who gets involved with this, if you ask any of our staff, feels the same way. Yeah, so the show is an interesting story. I had started my solo practice back in 2016 in June. And a few months into the practice, I came in one day and here we are. I've got about 2 employees. We're in this borrowed office space and the girl at my front desk says, you know, we got a call from this production company who has a deal with the Learning Channel, and they want to produce a show on bariatric surgery, and specifically taking an entire family through bariatric surgery. And I honestly didn't think it was real. And so I said, I'll tell you what, if they will bring lunch to everybody in the office next week, I'll be happy to talk to them, thinking I would never hear from them again. Well, here they come in the next week, and they brought lunch for everybody, and we started talking about this, and I kind of looked around the room, and I realized, this is real. I think they're serious about doing this. So I said, sure. And I went and talked to the hospital about it. We've done the shows over at Piedmont Hospital, and they were on board with getting going with this thing. So we went through season 1 of Family by the Ton, which premiered in 2017, and it did pretty well. 2018 brought a second season of that, and then we were supposed to do this little one-off show in 2019 called 1,000-Pound Sisters, which really just, the sisters on this show, they were fantastic. They're really kind of a kooky pair, and they just sort of struck a chord with not only folks in America, but really all over the world. And that became a really big hit. So after 2 seasons of that, we sat down and came up with our current show, which is called Too Large. Too Large is much like the 600-Pound Life format, where we take an individual patient or a patient and their friend, and we take them through their journey in a single episode through the decision of having bariatric surgery, having it, and then outcomes later on. What I really like about this show is, I believe more so than the other shows out there, this really displays an air of hope. Patients come in, and I'm always quick to ask them, why do you want to lose this weight? What is your goal? How would your life be different if you weren't imprisoned in this body that you have right now? You find out those things, then to get to see that to fruition, I think really helps the world out there. Not only, if you're not going through this, understand what it's all about, but it also speaks to patients who may be sitting out there and thinking, there's no hope for me. They see somebody in their similar predicament that gets to go through this, and at the very end start living the life they want to live, and that opens the door for them to say, hey, maybe that could be me too. So right now, that's our show. It's called Too Large. It's on Discovery Plus, and you can stream it anytime you want. So hopefully you'll check it out and enjoy it.